Hi, we're going over Chapter 20 in the MDA book today, Procedure 20.1. So this is placing and removing surface barriers. So when you are placing and removing surface barriers, it's important to remember that when you are placing the barriers, it should be done prior to the patient arriving. So you're going to need liquid antimicrobial hand soap, utility gloves, and plastic surface barriers and non-contaminated surfaces in a dental treatment room. So the first thing you're going to do is wash and dry your hands. As usual, you're going to use liquid soap. You need to know which surface barrier is going to be on the surface. So you're going to have different types of barriers going over different things. So like over your chair, you usually have a bag that type barrier that goes over the chair or even just the headrest. But when it's over the handles, as you can see here, they have like, they're almost like little pieces of squares of tape that just go right over the handles, but they can have little bags that fit over the handles depending on how the handles are designed. So remember that if the surfaces to be covered have been previously contaminated, you need to put the utility gloves on, pre-clean, and then disinfect the surface. So what is pre-cleaning? Remember, to pre-clean, you have to get off any of the blood and debris, saliva, anything like that first. Clean off any of the heavy debris that's there, clean, and then you disinfect after you've pre-cleaned. You don't just clean it one time. That's not cleaning it. So you have to like remove all of the debris, make it look clean, and then disinfect it. So you then wash, disinfect, and remove your utility gloves, wash and dry your hands, then you can apply the surface barriers with bare hands. Each barrier has to go over the entire surface to be protected. So you want to think about it like where you're going to be grabbing that light handle. Make sure that that whole surface is covered if you're using that tape. And check the barrier is secure and isn't going to come off. So that tape is like in these, it's just like tape, a big piece of square plastic. You want to make sure you don't just tap it on there and then it's not going to just float down and fall off during the procedure. You want to have it around that whole handle so that you know that when you go to grab that handle during the procedure, everywhere that your hand touches should be covered in that tape. If it slips out of position, the underlying surface is going to be contaminated, and then you're going to have to pre-clean and disinfect it, which negates the barrier's purpose. You're going to wear your utility gloves to remove the contaminated surface barriers after dental treatment. The reason you wear utility gloves is to protect the skin from contamination. So these green gloves here, like dishwashing gloves, are the utility gloves they're talking about. And this is what you should be wearing when you're cleaning rooms and when you're cleaning instruments and doing instruments in the ultrasonic, rinsing them and putting them into the sterilization pouches or cassettes. You're going to very carefully remove each cover without touching the underlying surface with either the utility glove or the contaminated outside surface of the barrier by flipping it inside out. If the surface is accidentally touched during the removal of the cover, the surface has to be pre-cleaned and disinfected again. Then you're going to discard the used covers in the regular waste. So remember, regular waste for these covers. They're not biohazard. They're not soaked in blood. So most states do not consider barriers to be regulated waste requiring special disposal. So we're going to put them in the regular trash unless they're soaked or caked with blood or saliva. Then we would put it into the regulated waste disposal. After that, you're going to wash, disinfect, and remove your utility gloves. Wash and dry your hands and apply fresh surface covers for your next patient. Your utility gloves are contaminated from handling the used barriers. By washing, drying, and disinfecting your utility gloves, you will know they're ready for the next use. Then when we move to procedure 20.2, performing treatment room cleaning and disinfection. Remember, you have to wear your PPE or your personal protective equipment, and that it's required for the healthcare team to ensure appropriate safety protocols are followed. You want to clean and disinfect the dental treatment rooms effectively. Now, what I always thought about when I was cleaning and disinfecting rooms or instruments is, one, am I protected? And two, if my family member walked in here as an emergency, is this room clean enough for me to just go ahead and seat them in this room? If it's not, then it's not clean enough for any patient. So you're going to need PPE, including utility gloves, goggles, and a mask, an intermediate level surface cleaner or disinfectant, and paper towels. So you're going to put on those utility gloves, the eyewear, and the protective clothing. That reason for that is to prevent contact with the contaminated surface and the chemicals, because those chemicals are kind of harsh and they will irritate your skin, especially over time. The latex exam gloves used in patient care should not be used for pre-cleaning and disinfecting procedures. And they're not always latex. So in here they say the latex examination gloves. Usually they're not latex. Very seldom are you going to find latex examination gloves. Most of the time they're using nitrile gloves nowadays in offices, and that is because of the high amount of latex allergies that people have these days. So they have tried to reduce the amount of latex used in offices in most cases because of the amount of people that do have allergies to latex now. Not saying that you won't find latex gloves in offices, just saying that a lot of offices have switched over to the nitrile gloves. Chemicals will degrade latex gloves and allow chemicals and contaminants to penetrate your skin. So make sure that if you're pre-cleaning a product and it's been prepared freshly and is fresh, that be certain to read and follow the manufacturer's instructions. So like if you have to mix something, make sure you mix it with the correct amounts. So if it says 1 to 10, make sure that you've got the 10 parts to only one part. You're not mixing it 5 to 10 to 5 or something like that. So it's important that you're mixing it in the correct amounts. So some products are concentrated and they have to be diluted for use, but we have to dilute them properly. So when we are cleaning, you're going to spray the cleaner on the paper towel or a gauze pad with the product. You don't spray the product directly onto a dental chair or a counter. You always spray it directly onto your paper towels. The reason for that is that a lot of times if you spray it directly onto the dental chair, it will affect the material of the chair over time and start to break down the material of the chair. So the manufacturers of the dental chairs, the operator stools, and the assistant stools do tell you not to directly spray them with cleaners, is to spray it on the towel and then wipe them down. And that also avoids spreading bioburden instead of removing it. So let's say you have saliva or blood on the chair and you spray it and then it just goes flying everywhere. So now you've got it, instead of just on the chair, you've got it on the wall, you've got it on the operator's stool, you've got it on the counter. So now you've got 4 places to clean that bioburden instead of 1. So keep that in mind, is to spray it on the towel and then wipe. So to disinfect, you're going to spray it on the pad, let the surface remain, or on the pad, and then wipe it and let the surface remain moist for the manufacturer's recommended time for tuberculocidal action. That's usually 10 minutes. So anything that we're using, it's going to have a TB kill time, and that's usually 10 minutes. So if the surface is still moist after the kill time, then you're ready to seat another patient. You may wipe the surface dry if it's still wet after that 10 minutes, but if it's before that 10 minutes, you're going to leave it wet. It needs to sit there for that 10 minutes to make sure that it's killed TB and anything else that we're worried of communicable diseases. Use water to rinse any residual disinfectant from surfaces that will come in contact with the patient's skin or mouth. And we do that because chemicals used for pre-cleaning and disinfecting can irritate a patient's skin or damage their patient clothing. So it's really important to always follow manufacturer's instructions on how to clean an item and how to properly maintain that item, whether it is changing the filters on the item, running the item like an autoclave, or cleaning the outside of it, running the instruments through it, whatever it is, always make sure you're following the manufacturer's instructions on it and using your PPE while you are using the items. Thank you.